Okay, the next thing I wanted to show you really quick is how to teach your patient how to use crutches. So your patient comes in, they have been injured, and you get an x-ray and confirm they've got a bone broken in their leg. So they will have these in the ER. And step one, you got to figure out how tall your patient is, because I want to show you how these work. If you can see down here on the sides, there are different height variations. And this set of crutches is for somebody who is anywhere from 5'10" to 6'6". And what you do, it's super easy. You just push this little button in, and then you can either lift this up for somebody who's 6'2" or 6'6", or you put the button in like this and shove it down, and for this person to be 5'10". Okay, so we're gonna make these 5'10" because, here, hold up for a second. Even though my patient here is not, did you already adjust this one? Okay. Even though my patient is 5'6", we're just gonna improvise because these are the only ones I have. So when you're teaching somebody how to use crutches, step one is safety, especially here in Michigan, because it's icy and snowy in the wintertime. And so now, instead of just using your 2 feet, now you've got these crutch things going on. So that's thing one. So you're gonna wanna make sure that your crutches have some kind of a rubber barrier on them like that to help keep your patient safe. The next thing is that the crutch will come like this, and which is fine. There's a lot of rubber on there until you've been on crutches all day, every day for several weeks, because broken bones, you're going to be in a cast and on crutches for probably at least 6 weeks. So your patient can put things like cushions on there. So a lot of your patients will put, just get another little pad and put a little cushion on top. However, when you're teaching your patient to use crutches, and you'll see this all the time, and I'm not 5'10", so the crutch should come to just right about here, right underneath the armpit. It should not be jammed in the arm, although you'll see people doing this all day long. So if people have had crutches and they're walking around on their crutches all day, pretty soon they'll put them right in their pits and they will start leaning on them. And so then if these patients are using improper crutch technique, by the end of the day, their axles are extremely sore. So really you need to teach your patient, and you're gonna have to go on the inside because these are too tall for you. You're gonna teach your patient to use their forearm and put most of the pressure here when they're walking, not on their armpit. This should not be in their armpit. That is really just for stability. So that's how the crutch should fit. And then when you're teaching the patient, it's a little bit tricky to walk on a crutch, which I'm not sure if we're going to be able to do this because these crutches are way too tall for you. But a lot of patients will put the injured foot down and then use the crutches and walk with like 2 crutches and their good foot, and that's completely opposite. So let's say that this foot is broken. So her right foot is broken, her right leg is broken. So what she's going to do is you're going to step forward as I'm teaching you how to use the crutches. You're going to step forward with your non-broken left leg while you're supporting the broken leg on the crutches. So really, these 2 crutches are going to take the place of the right leg. So every time the patient would step forward with the bad leg, they're going to put the crutches are going to go down out first, and now that becomes the leg. So you're going to support that with your crutches, take your step forward, and then you can walk with your good leg, which this is a little bit hard to show you how to do this because the crutches are too tall. But so that's how you do it. And so make sure that you're watching your patient walk on the crutches before you let them leave the ER, because a lot of people will try to put pressure on the broken leg rather than use the crutches to support the broken leg. Another thing that they do now, especially with safety, is they have those little carts that the person can just rest their broken leg on the cart and then kind of move around with the scooter, and so then their non-broken leg just becomes like the scooter motion. So you're seeing that a lot more. It's a little bit safer and more comfortable for the patient. So, okay, that's it with Cass.